this is a very important topic. And the term hygiene occupancy means what percent of your available hygiene appointments end up getting filled at the end of the month. In other words, of the available hygiene appointments you have this month, we measure this monthly, what percent ended up getting filled? Well, Naren, our listeners may be familiar with the term hotel occupancy. Naren, yes. you're probably familiar with the term hotel occupancy. And what that simply means is of the available hotel rooms, how many of them got sold that night? And obviously the higher occupancy they have, the better. So we kind of borrowed that term or adapted the term hotel occupancy to call it hygiene occupancy. Kind of a simple way to think about it and a very, very important metric. None of the practice management software, the three main software platforms, Dentrix, EagleSoft, Open Dental, and all the other peripheral practice management systems, none of them measure this, Naren. The only metric system that I know that measures this is Dental Intelligence. Dental Intelligence measures this. But Dental Intelligence isn't a practice management software. It's a KPI software. So it's brilliant, by the way. If you don't have Dental Intelligence, you should. However, most offices have no idea what their hygiene occupancy is because they can't pull a report from their practice management software. So, quoting one of my all-time favorite authors, Stephen Covey, his book, 7 Habits of Highly Effective People, he identified the habits that highly effective people have. And habit number 2, for people that are effective in their lives, they begin with the end in mind. So, Naren, I'd like to think that all of our listeners would like to be effective. Let's begin with the end in mind. So what are we looking for? We're looking for a hygiene occupancy of 92% or more. 92% or more. Notice that I didn't benchmark it as 100%. Naren, why do you think I didn't benchmark it at 100%?
Yeah, I think because it's impossible. And when you set an impossible target, people don't achieve it.
It's not realistic.
Yeah.
It's not, you're exactly right. It's not realistic. And if you set a target that you or your team members feel is unrealistic, it can kind of have a demoralizing effect. It's like, man, try as hard as we can't get there. So we've studied this. We've studied it with data across quite literally thousands of practices. And in our studies, and we look at world-class practices, what do world-class practices have as hygiene occupancy? And the answer is 92% or above. Certainly you can be above 92%. But 92% or above is really, really good. And I'm going to amplify that a little bit and say it's also very challenging. That is not an easy mark to hit. That will require most of our listeners to stretch. In other words, you're going to have to stretch your skills, your protocols, your systems to get to 92%. And if I could frame this even broader, why is the whole topic of hygiene so important? Well, I'm a huge believer in a hygiene-driven practice. The more activity we have in hygiene in your practice, the stronger your practice is. And if we step back and we look at it in service of our patients, this is another reason. If we think about everything we do is how do we better serve our patients? Hygiene occupancy is a very important goal because we know that if we see your patients on a regular basis, if they have healthy gums, if we see them every 6 months, if they're periodontally involved, we might be seeing them every 3 or 4 months. But if we see your patients on a regular basis, we accomplish 2 things. We keep them as healthy as possible, and we reduce their future dental expenses. Now, how do we reduce our future dental expenses? By catching things at early stage. So we catch things at the early stage, and perhaps we can treat them more conservatively before it becomes something a lot more complicated and in the eyes of the patient, more expensive. So it's really important to get our patients engaged and committed to a regular hygiene schedule. So our goal is, back to hygiene occupancy, 92% or above.